వెల్కమ్ టు G3 మీడియా. భారతదేశంలోనే తొలిసారిగా ఒక పోలియో బాధితుడికి ఎల్బీ నగర్ కామినేని ఆసుపత్రి వైద్యులు విజయవంతంగా గుండె మార్పిడి శస్త్రచికిత్స చేశారు. ఖమ్మం జిల్లాకు చెందిన 45 ఏళ్ల భాస్కర్ వృత్తిరీత్యా టైలర్. అతడు తీవ్రమైన గుండె వ్యాధితో బాధపడుతున్నాడు. గత 3 ఏళ్లుగా అతడికి పాక్షిక పోలియో కారణంగా పరిస్థితి మరింత విషమిచ్చింది. దాంతో ఎల్బీ నగర్ కామినేని ఆసుపత్రికి రాగా ఇక్కడి గుండె మార్పిడి విభాగాధిపతి కన్సల్టెంట్ కార్డియో థొరాసిక్ సర్జన్ డాక్టర్ విశాల్ వి ఖంటే, కన్సల్టెంట్ హార్ట్ ట్రాన్స్ప్లాంటేషన్ కార్డియో థొరాటిక్ సర్జన్ డాక్టర్ రాజేష్ దేశ్ముఖ్ తదితరులతో కూడిన బృందం ఈ అసాధారణ శస్త్రచికిత్సను విజయవంతంగా పూర్తి చేశారు. ఈ సందర్భంగా కామినేని హాస్పిటల్ సిఓఓ డాక్టర్ గాయత్రి కామినేని మీడియాతో మాట్లాడుతూ భాస్కర్ గుండె సమస్యల వల్ల గుండె సరిగా కొట్టుకోకపోవడం, రక్త సరఫరా తగినంతగా లేకపోవడంతో పలు రకాల ఆరోగ్య సమస్యలు తలెత్తాయి. దాంతో అతడికి తప్పనిసరిగా గుండె మార్పిడి చేయాల్సి వచ్చింది. ఇందుకు దాదాపు 5 గంటలకు పైగా సమయం పట్టింది. బ్రెయిన్ డెడ్ అయిన ఒక వ్యక్తి గుండెను దానం చేసేందుకు ఆయన కుటుంబ సభ్యులు ముందుకు రాగా భాస్కర్ పాత గుండెను తీయడం, కొత్తదాన్ని అమర్చడం, దానికి రక్తనాళాలు ఇతర నరాలను అత్యంత ఖచ్చితత్వంతో అనుసంధించడం ఇదంతా చాలా సంక్లిష్టమైన ప్రక్రియ అన్నారు. ఈ శస్త్రచికిత్సలో పాల్గొన్న కన్సల్టెంట్ కార్డియోథొరాసిక్ సర్జన్లు డాక్టర్ విశాల్ ఖాంటే, డాక్టర్ రాజేష్ దేశ్ముఖ్, చీఫ్ కార్డియాక్ ఎనెస్థెటిక్స్ డాక్టర్ సురేష్ కుమార్, ఎస్ఎంపల్లి కన్సల్టెంట్ ఎనెస్థెటిక్స్ డాక్టర్ రవిలి సాడే, సుశితులైన ఐసీయూ సిబ్బంది, నర్సింగ్ బృందం అందరూ ఇందులో చాలా కీలక పాత్రలు పోషించారని తెలిపారు. ఇంత క్లిష్టమైన శస్త్రచికిత్సను విజయవంతంగా పూర్తి చేసిన అందరూ డాక్టర్ల బృందానికి కృతజ్ఞతలు తెలియజేశారు.
And to also let the world know is that we have actually achieved something by giving normalcy back to the patient. So I would like to give the mic on to my colleagues here to talk more about Mr. Bhaskar, who is with us right now, and what has been the process of it and what is the thought process behind going ahead with such a complicated case.
But here the thing is, the change what he gets is a quality of life. So you are living better. That is what it makes a difference for the patient, and hopefully the support continues. And I think you can see the patient, probably you can talk to the patient and get the best out of what his experience. I think that is invaluable than our words. I think so. I think, yeah, thank you.
The highlight point what we want to tell you is very rarely any organ donation happen to the compromised patient in the society. Patient is already compromised because of polio. Why to waste a heart or why to waste any kidney, liver for a transplant in a compromised patient who will not be productive for the society? Here we have taken a bold step to give a heart, replace the failing heart to a patient with polio. But now you can see he is up to on his legs and he will be productive to the society. He will lead a normal life in the coming days where he will be fruitful and happy about the gift given to him. Generally in all over India or all over the world, heart or any organ is not donated to a person. That is legal issue, means ethical issue. The organ is not given to a person who cannot perform or be useful to the system or society. Here you see we have set up an example by doing this, that a patient with polio can also lead a useful life. He can be useful to his family and society. That's the point we want to tell, that yes, every patient is important, every life is important. Thank you. Dr. Suresh would like to say this and inform these things in of cardiothoracic surgery. So to tell you the story of patient Bhaskar. Patient Bhaskar is a tailor by profession at Khammam, and he has genetic disease of cardiomyopathy. That means heart gets on dilating and failing over a period of time. He was getting treated in Khammam with a cardiologist since last 3 years for heart failure. Over a period of time, heart failed so much that he was not able to do his day-to-day job. Even going to bathroom he was becoming breathless. So that is called end-stage heart failure. In end-stage heart failure, the only option remains is to put a new heart, which we could achieve in Kamineni. The other important feature of him is he is a patient of polio, with residual polio in his right leg. So he used to walk with support. where he could not walk, now he is walking with support, same back to normalcy. So the patient is here. Further details about the surgery and how we got the donor or what we did during surgery, Dr. Rajesh will go ahead.
Thank you so much. Very good afternoon. So I'm Dr. Rajesh Deshmukh, consultant in cardiac surgery in Kamineni. So today, I think more of the things that Dr. Vishal has already emphasized on it. So knowing about the patient, you should know that already we have around 1,000 patients per 1 lakh patients, nearly 1 lakh population of polio survivors. And although the polio has been eradicated currently, but we still have a significant population and healthcare needs which has to be met among the polio survivors. And here this is one of the kind of case which we had to deal with. So the problem with these patients is they were not able to do physical work actively. So when you're able to walk 2 kilometers, then you can have symptoms. So these patients usually don't have symptoms and they don't manifest, or in other words, they don't consider the symptoms they think it's a part of the polio or any other disease which they already exist. So here, I mean, although he was evaluated with a cardiologist and referred timely, so taking up this case was a little bit challenging because one is they are socially dependent and rehabilitation and also familial and interpersonal relations matter a lot to the patients who are disabled. And it is not a routine person who's to walk or work in a regular setup. So this was quite a bit challenging case, although these patients have autonomic neuropathy, what we call. So that means some of the nerves get damaged. So this physiology is not explained well till now, and we didn't know how to deal with it. Anticipating the problems, we were ready for it. But then also after the surgery, the most important thing is that, you know, when you do a cardiac transplant, we cut upon the breastbone, and which is the chest, in the center of the chest. So this patient has a walker. He has to walk with a support, and there's a lot of stress on the breastbone. So the wound does not heal because he's on a medications where the steroids and immunosuppressants, which have a difficulty in the bone healing. And so he had to have a special care about the physiotherapy and rehabilitation and also the psychological support he needed. So in this case, so it was well met for the patient. And regarding the heart transplant, as is the surgical aspect, we have a very good cardiac transplant going on in our place. And so with the support of the management, of course, and we have quite a bit of patient registered for transplant, and almost the patient was registered for 2 to 3 months. The pre-operative workup was done, and once the Jeevandan gave a green signal to go ahead for the transplant, the patient was taken up, and with the satisfactory reports what we found in the pre-op evaluation. And once the patient was ready, and even with the counseling and all the consents which was done, so almost the cardiac transplant took almost for 6 hours of surgery. And post the surgery, it was uneventful. As such, we didn't find any events during the surgery. And then after the ICU care, so Dr. Suresh was there, and who's been taking care during the surgery, who's our anesthetist, and in the ICU too. Like, you know, it's not just the surgery part. Surgery is just one aspect of this whole procedure. So the major procedure which involves is the cardiology support. Before the surgery they evaluate, and during the surgery, and then after the surgery. So the major role for Dr. Suresh was to take care of his injections which are met after the operation. And along with that, again, as I said, the most important thing is infection control in these patients, because they are already under drugs which they are more susceptible for infections. So thanks to Dr. Suresh for managing it very in a